Good morning, everybody. Thank you for joining us for our press briefing with regard to the state's response to the pandemic. As always, we remind people, please continue to follow all the rules and use the tools we've given you to help slow the spread of the virus. So, for example, you may notice that I am continuing to wear my face mask today. That is because a week and a half ago, I was exposed, and so I am following our DHM rules. I stayed home for the first week, tested negative after, on day 5, so I could leave the house after day 7, but need to continue to wear a face mask everywhere I go as part of our directed health measure rules. So that's why I'm continuing to wear the face mask, which is a departure from what I usually do. But again, we want people to really follow our quarantine rules because this will help us slow the spread of the virus. So thank you all very much for all your participation to do that. We've seen our case counts go down, our hospitalizations go down. Our current hospitalizations are 240, which is about 7% of our hospital capacity, but down significantly from the 987 we were in November. So we want to continue to slow the spread of the virus and continue to bring those hospitalizations down. Our hospital capacity is at 34% of our hospital beds, 37% of our ICU beds, and 80% of our ventilators. And so again, this is why we're taking all these steps to be able to make sure we preserve that hospital capacity for those folks who need it. So please continue to remember, when you go out in public, keep that 6 foot of distance between you and other people when you can. Wash your hands often. That actually kills the germs. 20 seconds at a time. Wear a mask when you go to the store. If you lose your sense of taste or smell, that's a dead giveaway. You probably got it. So please, if you lose your sense of taste or smell, stay home, go get tested. But that's another one of the signs that you may have coronavirus. Along with like cough and high fever, that sort of thing. So if you have those symptoms, please stay home. And then another thing I want to talk about that we want to make sure people know is out there is our monoclonal antibody treatment. Okay, so this is an infusion, and your doctor has to write a prescription for it. But if you are in that older category, say age 65 years and plus, and you start experiencing symptoms, please talk to your doctor about the appropriateness of you getting that infusion. I've talked to people who had it, and they said it worked wonders to help them start feeling better right away. I think we've used it very effectively here in Nebraska to reduce our hospitalizations. It's a treatment that will help bolster your immune system against the coronavirus and to help avoid those hospitalizations, and it's been very effective. So we want people to know that there's this treatment out there, monoclonal antibody treatment. Talk to your doctor. This is a great way to be able to help if you do contract the virus to make sure you're not going to the hospital. So please talk to your doctor about that. And doctors, if you are not familiar with the monoclonal antibody treatment that's out there, please get educated about this. It's something that can help your patients avoid going to the hospital. So please do that. All right, and of course, another way to be able to help fight the virus is by using testnebraska.com. Testnebraska.com is a burden-free way to be able to get tested. We're turning those test results around very, very quickly. We're shooting for 24 to 48 hours. In the last 7 days, we've had them turned around in a little over 12 hours. And that was kind of my experience when I got tested last week. The results came back very, very quickly. So testnebraska.com, we've done 667,000 tests out there already. So, and then actually over 2 million assessments have been done as well by the folks who've signed up for that. So testnebraska.com. Vaccine update. So first of all, just remind people that you can all go to vaccinate.ne.gov, vaccinate.ne.gov to sign up on the state registry to be able to get the vaccine. So that's going to be kind of our central database warehouse there. So please encourage you to go get signed up. If you're having difficulty with that, you can call a toll-free number, 833-998-2275. It's 833-998-2275. And there's a hotline there that's open 8 a.m. to 8 p.m. Central Time. So please take advantage of that to be able to get signed up for the state registry. We have delivered 246,000 vaccinations out of the approximately 350,000 we've been allocated. We're ranking about number 13, according to the New York Times, in the country with regard to vaccines distributed as a percent of population. Second, vaccines as part of the population. And that's really one of the measures we're looking at here as a state, is how many people are getting the full vaccine as far as percent of the population and how much we're using. So we're paying a lot close attention to that. One of the things that we noticed is that the CDC did not have updated numbers from the state with regard to the number of vaccines that had actually been administered. Our team was working with the CDC folks last week. We had a gap of about 26,000 vaccines that we had actually delivered that the CDC was not recording that we had administered. And so we found an issue with regard to their database and getting to their analysts and so forth, and so we've seen that gap narrow, and we're going to continue to work with the CDC to make sure they've got the most up-to-date numbers from Nebraska, so that's reflected in the data that they are providing. But we did find that gap in between what we were actually doing and what they actually were reporting, and we were able to work with them to be able to kind of, or to be able to at least narrow that gap. All right, so I think that's what we got with regard to all of our vaccine updates, though we will have a couple of guest speakers here. One of them is going to be Dr. Ralph Lassiter, who is the senior pastor at Mount Moriah Baptist Church in Omaha. But before we bring him up, we're going to sign a proclamation for Black History Month. Now, Black History Month was actually started by Nebraska-born President Gerald Ford to recognize the accomplishments of the African-American community here in this country. And we have a lot of great Black business leaders, athletes, lots of other contributors here in our state to recognize. So I just want to run through some of them because it's, as you may know, I'm kind of a history buff, and there's a lot of fun history here that we may not know about, and certainly it's important to recognize the contributions of our African-American citizens that have made to our state and to our nation. So, for example, Aaron Douglas was a talented artist and influential figure in the Harlem Renaissance, who earned his bachelor's degree in fine arts from the University of Nebraska-Lincoln. Of course, many people are familiar with Herman Cain, who was the business leader, the successful CEO of Godfather's Pizza. Also want to recognize Kathy Hughes, who was the first Black woman and entrepreneur to chair a publicly traded company, which was Radio One, a media firm. Whitney Young, Jr., who taught the University of Nebraska and Creighton University, played a leading role in the civil rights movement and was the executive director for the National Urban League. Marlon Briscoe, okay, so those of us who are maybe a little bit older probably remember Marlon Briscoe, Omaha South grad, who was the first Black quarterback in the NFL, came from Nebraska, obviously. And of course, reigning boxing champion Terrence Bud Crawford is the best of the best, right? 37-0 in his boxing matches. Again, hometown here from Omaha, so we're very proud of Bud. Then also Angela Mercurio, who is three-time All-American, was named the 2019 NCAA Woman of the Year for not only her athletic accomplishments, but also her community accomplishments in addition, and to that, and her classroom accomplishments. And of course, Hall of Famers Bob Gibson, pitcher for the Cardinals, Gale Sayers, running back for the Bears. And of course, we can't leave off Johnny Rogers and his contributions to the University of Nebraska football team, again, back when I was growing up. And then another one that I want to mention that I'm guessing a lot of folks may not be familiar with, but our first Black legislature here in Nebraska was Matthew Ricketts, who served from 1893 to 1897. So we've got a lot of folks who have made great contributions to our state, and we want to recognize that with our proclamation for Black History Month. And so I am going to sign the proclamation and make this official. All right. So with that, I'd like to go ahead now and call up Dr. Ralph Lassiter, who is going to talk about his experience with regard to getting the vaccines, the vaccination. And so, Dr. Lassiter, please come up.
Thank you, Governor Ricketts, for your leadership as well as for that proclamation. I also want to acknowledge a good friend, another leader in our state, and that's the HHS CEO, Danette Smith. Again, my name is Ralph Lassiter, and I serve as the lead pastor for the second oldest predominantly African-American Baptist church in the state of Nebraska. Lincoln hosts the oldest predominantly African-American Baptist church in the state, and that is Mount Zion Baptist Church, led by a great young pastor, Reverend Tremaine Combs. In acknowledgement of Black History Month, I want to share with you an African proverb that many of you may have heard before. The proverb states that every morning an antelope wakes up and it realizes that it must outrun the fastest lion or it will become eaten. At the same time, somewhere on that same African plain, a lion wakes up and it realizes that it must outrun the slowest antelope or it will starve to death. Moral of the story, it really doesn't matter whether you're the lion or the antelope. When the sun rises, it's morning, it's best that you get running. And so I want to suggest that here in the state of Nebraska, to my faith-based brothers, it's time for us to get running. So let's begin our run with just a few facts. First of all, the COVID-19 coronavirus pandemic has taken the lives of too many in our state and across this nation. Vaccination is the surest and safest way of achieving what some refer to as herd immunity. And by doing so, we can save the lives of thousands and allow our citizens to return to work and my parishioners to return to worship. Unfortunately, some church folks and many people of color oppose taking the vaccine. Why is that? Well, many members of the clergy and people of faith oppose taking the vaccine because of reports that the vaccine has a basis of fetal tissue. For those who are pro-life, as I am, it's important to understand that 4 of the 6 vaccines, including the Moderna and the Pfizer vaccine, is not built on fresh fetal tissue. In addition, I think most of us have heard that many Catholic bishops have endorsed the Moderna and the Pfizer vaccines. Now, for my Black brothers and sisters who say they won't or they probably won't get the vaccine, I understand the general mistrust of governmental medicine that exists in many of our communities. I was alive in Mississippi 60 years ago when this trust, should I say, gained its foothold as a result of the Tuskegee experiment. And that's where for over 40 years, Black men who had syphilis were allowed to not receive treatment in order for scientists to examine the effects of that deadly disease. So to all of my brothers and sisters of color, whether you're Native, whether you are Latino, whether you're Black, your hesitancy about taking the vaccine is understood, but I need to ask that we keep these 2 things in mind. First of all, our communities have been the hardest hit by the COVID-19 pandemic. Second of all, the vaccine is our only line of defense. To my Christian brothers and sisters, I know many of you say that your faith will protect you, but I believe that God gave us science as a way of understanding the wonders of His creation. And I also believe that if you think about it, we all use science to make our lives a little easier. When I drove down here today, I drove in a car and I had many buttons that I could push. A little different from the 1951 Chevrolet pickup that I learned to drive in. Some of you have a cell phone that has more computing power than the first Trash 80 that my son played around with many years ago. And I'm sure some of us may be taking medication to regulate our blood pressures or to reduce our cholesterol. So as a man of faith, I believe that every good and perfect gift comes from above, and I believe that this vaccine to fight COVID-19 is truly a gift from God. So, to my brothers and sisters, black, brown, red, yellow, all colors, we are not on the plains of Africa. We are on the plains of Nebraska. It is morning time, and it's time for us to start running. We need to, first of all, run with the truth as our guide, because the Bible says, if you know the truth will set you free. So as a state and as individual communities, the truth is we can conquer this pandemic. As pastors and as the church community, we can do our part by telling the truth about the value of wearing masks and of receiving the vaccination. As individuals, whoever you are, wherever you are, you can do your part by running not on the plain after an antelope or away from a lion, but you can do your part by taking the vaccine as soon as it's available to you. I believe that we have to do so not just for our own benefit, but for the benefit of our families, our neighbors, the elderly, and all of those who are in some way compromised by this disease. 28 days ago, I received the first of the 2 shots, the Moderna vaccination, and at 4:20 this afternoon, I'll return, and I will receive the second shot. And afterwards, I'm going to praise the Lord because I know that I have another line of defense. I encourage you to do the same. Thank you.
Thank you very much, Dr. Lasser. I appreciate it, and I appreciate for being so prompt also about going back and getting your second dose. Yes. So believe it or not, we've actually had a number of people who got the first dose but have not gone back for their second dose yet. So thank you for doing that, and thank you for sharing that perspective. We really, really appreciate it. Because at the end of the day, the way we ultimately work our way through this pandemic is by getting vaccinated. So thank you very much, Dr. Lasser. All right, so next I want to talk about what we've been doing at the state to continue to deliver on our mission to create more effective, more efficient, and customer-focused state government. As you all know, this is one of the things that we really have tried to focus on, is how do we make sure we're improving what we're doing each and every day through process improvement. At the state, we use the Lean Six Sigma methodology to be able to teach our teammates about process improvement and allow them to get various levels of accreditation, if you will, within that methodology. So different belts. So whether it's a white belt, green belt, yellow belt, black belt, as they progress through the system and gain more experience, they get higher levels of accreditation. And that's what helps us look at how we can get rid of waste, streamline steps, reduce the number of steps, and improve customer service. So it's a key part of how we're driving that through all of our state agencies. So back in 2016, we created our Center for Operational Excellence. And that Center of Operational Excellence has worked on over 450 process improvement projects and saved over 450,000, Matt, is that right? 450,000 hours of state teammates' time? So we've saved a lot of time, and it's resulted in different projects. And I just want to highlight a couple of them. Obviously, there's 450, there's a lot, but one of them is in our Department of Health and Human Services, was for our disabled children's program, or the programs that are really targeted at those families who have medical needs. Sometimes they travel to go see specialists, and the state reimburses them for that travel. But for some families, that's a burden to have to wait for that reimbursement. It was taking as long as 15 days. But our team took a look at that process for reimbursing those families, cut the number of steps down from 80 to 62, and cut the number of days it took us to issue that reimbursement check down from 15 days to less than 3 days. Or another example is in our Department of Transportation with what we call our green sheets. Now, green sheets are the sheets that we create to make sure that our contractors are following all the environmental rules, whether it's preventing erosion or making sure we're protecting endangered species or historic places, or how to dispose of hazardous materials. So these are the ways that we look at, or the sheets that say, hey, these are the requirements to make sure you're following all the rules to be able to protect these things and protect the environment. And so we create these green sheets that are then given to our contractors, put in their contracts about what they have to do, what their responsibilities are for this. And again, same sort of thing. We looked at how many steps. We were able to cut it down from like 87 steps to 60 steps and cut the number of days down from 16 days to 3 days to be able to get those sheets done, which then allows our contractors to get into the field sooner, get to work sooner, be able to create the transportation system for our citizens sooner. So those are just a couple of examples of how we've leveraged the Center of Operational Excellence to save time and improve customer service. And Matt Singh is one of our black belts. He's actually the person who leads the program. He's going to come today to talk about our one-stop portal. And I think we have it up on the screen here, right? Our one-stop portal is our place for if you're looking to create a business in Nebraska, that you can come and figure out all the things you need to do, what forms you need to have, what you need to file, what agencies you need to interface with to be able to get your business going here in the state of Nebraska. So another way that we can make it easier to do business with the state, to do business in Nebraska, to help us grow Nebraska, which is the focus of all the things we're doing here. So with that, Matt, I'm going to ask you to come up and talk about our one-stop portal.
Good morning. I'm Matthew Singh, the Director of the Center of Operational Excellence in Department of Administrative Services. Back in 2019, the Governor Ricketts administration reached out to us and asked us to support a vision he had, a vision to make Nebraska more effective, efficient, and customer-focused. An idea to make it easier for entrepreneurs and business folks to get all their filings done in one spot. The Center of Operational Excellence engaged its black belt team in order to help make this happen, partnering across agencies, partnering across divisions and lines to get support from all directions to make this happen. By December 2019, we had phase 1 of the project complete and the website was launched. Then we spent a time period taking feedback from the people, feedback from the governor, feedback from agencies, feedback from everybody in updating the site. The governor's office called again in 2020 and said they'd like to do a phase 2. This time, the phase 2 was to focus on making it sustainable, a governance structure. How do we make sure that this website's around for many, many years? Also including the non-codes and some constitutionals, expanding the horizons of the municipalities involved in this process, in this website. Phase 2 was completed by December 2020, and it was a truly honor to be able to support this administration and the state of Nebraska in this endeavor. The Black Belt team, the Center of Operational Excellence Black Belt team, are the ones who executed this one. In this case, it was Dr. John O'Keefe was the head project manager of this project. The services we provided was project management, making sure that we meet timelines, scope, budget, making sure that as conflicts come up that we can resolve them in a professional and customer-focused manner, making sure that communication happens across all boundaries. In addition, we helped with facilitation of important meetings and timeline management for key milestones associated with the expectations set forth by all the key partners. And that's the benefit of the Center of Operational Excellence Black Belt program. You heard Governor Ricketts talk about the different belt levels. We have white belts for beginners, yellow belts for middle managers, green belts for full-time practitioners, and executive green belts for the executive staff, and black belts. Black belts are the level that help the Center of Operational Excellence do projects that engage the entire enterprise. They work across agencies, it works across boundaries to just get things done. These are practitioners that spend well over a year in intense training. So to become a black belt, you have to spend a year at the green belt level, being full-time continuous improvement. You go through intensive project management training, tests, simulations, real-life experiences working with the Center of Operational Excellence. And they learn how to support not only project management, but continuous improvement, facilitation, and really anything it takes to get the job done. This year alone, the Black Belt Black Belt program of the Center of Operational Excellence has helped with several projects. A couple I wanted to call out and highlight was a partnership between the USDA and the Nebraska Department of Environment and Energy. Those two agencies partnered to bring about a common process for wastewater, and the Black Belt program was glad and honored to be able to support that and facilitate that. Also, Black Belts throughout the state of Nebraska launched the Continued Education Portal for continuous improvement, impacting over 5,000 state team members every quarter with continued training on how to do iterative improvements in your everyday workplace. And additionally, the Black Belt team has successfully trained 8 new Green Belts. And these are people that are full-time positions placed within each agency to work on projects that are important to making the agency more effective, efficient, and customer-focused. So with that, I do want to hand it back over to the governor, but I want to say thank you to you guys for being here, and thank you, Governor Ricketts, for the support and the ability to participate in this manner.
Great. Thank you, Matthew. Appreciate it. You and your team are doing great work and continuing to help all of our teammates focus on process improvement and how we can do a better job serving the people of Nebraska. So thank you very much. All right, so our upcoming schedule before we get into Q&A is that we will have another press briefing here at 10 a.m. Central Time, same room on Friday. And with that, we'll go ahead and get into questions and answers. First, submitted ahead of time, Grant Schulte, Associated Press. The White House announced yesterday that the federal government is going to be sending more vaccines directly to community health centers. Do you have any concerns about this, given what you have seen said about the state needing more doses? So to that in particular, again, we welcome more doses of vaccine. And with regard to this program, we'll work closely with the federal, our federally qualified community health centers, our FQHCs, to be able to make sure that we're doing a good job of providing for those communities and making sure that we're getting those doses out in a timely manner. If so, what's problematic about this new approach? So again, I think with the relatively few number of FQHCs we have in the state, we'll be able to work with our local health districts, departments, to be able to work with each of those in their health departments to make sure that this program is managed pretty smoothly. So I don't really have any concerns about this. Are the community health centers doses going to come out of the state's normal allotment? And no, they will not come out of the state's normal allotment. These are going to be new allocations on top of what the state is getting already. So again, we certainly welcome additional doses coming to the state. I think with the FQHC program, we can work that with it. We had a White House call yesterday about this. One of the things that we need to make sure we're doing is just coordinating well between everybody so that we can make sure the doses are going out in a timely manner and that we're keeping track of who's getting the second dose and all that sort of good stuff. So Cassie Crow from WWT says, with many residents and staff in long-term care facilities now vaccinated or in the process of being vaccinated, when will the state revise its guidance for long-term care facilities? So, and then she asked, what might that guidance look like? So let's break this down a little bit. So long-term care involves 3 broad categories. Skilled nursing facilities. Those skilled nursing facilities are actually regulated by CMS, so that's the federal government, the Center for Medicare and Medicaid Services, right? So they have their own regulatory scheme, which the state has no ability to change because that's done by the federal government. So they've got their own rules for those skilled nursing facilities. Then there's the assisted living facilities, and the state does regulate those, and we have already put out guidelines for those. So we've issued guidance saying that if an assisted living facility has 90% of their staff and residents inoculated, vaccinated, they can start allowing visitations. Now, some facilities may be being more restrictive than the state, or some assisted living facilities may also have skilled nursing facilities attached to them or an independent living attached to them, and so they may have people moving back and forth, and so they may be taking greater precautions. But in general, if you're in an assisted living facility and 90% of the staff and residents are vaccinated, then you have the ability to start allowing visitations. And we know that this has been a hardship for the families to not be able to see their loved ones. We know it's a hardship for the residents not to be able to have that interaction. So we certainly want to make sure that all these facilities are doing the most that they can to be able to facilitate those visitations, to allow for that interaction, we got to slow the spread of the virus, but we also have to remember there's also like mental health considerations and so forth we have to take into consideration when we're thinking about this. So we certainly encourage those facilities to do the utmost to be able to allow visitations. And then I said there were 3 broad categories. There's a third category called independent living. Independent living facilities were not a part of the federal pharmacy program for long-term care. That was the federal government's decision on that. So they're in a separate category entirely. We are working across the state to be able to get those folks vaccinated, but they were not a part of the original federal program that targeted the other long-term care facilities, the skilled nursing facilities and the assisted care. So I'm sure that was a much longer explanation than Cassie was looking for. But again, generally, if you're in assisted living, 90% of the staff and residents vaccinated, we want to encourage you to start allowing visitation. All right, so Paul, Fox 42K PTM. DHH has said that the details from the federal government about the federal retail pharmacy program have been limited to this point. Has any new information emerged? Also, if someone is getting the vaccine, would they have to register with the pharmacy as well as the state? This is an area that we do have concerns about, and that the federal government could have done a better job as far as coordinating with the states before they launched this program. We expect that there'll be 43 pharmacies in the state that have signed up, at least. There's 43 pharmacies that have signed up for this federal pharmacy program that is supposed to be launching tomorrow. We expect about 5,700 doses will be coming in to the state through this program. The challenge is making sure that we're coordinating with those pharmacies and local health departments and the state to make sure that they're following our guidelines with regard to 65 years and older, our folks in Phase 1B, and that good information is flowing back and forth between the pharmacies and the state so that we can keep track of who's been vaccinated and have good records with regard to inventory management and all that sort of thing. Right now, the federal government launched this program without having a way for those pharmacies to communicate with us or even coordinate the scheduling. And that's where this program could have been improved, is if we'd worked ahead of time on communication between the pharmacies and scheduling so that could be seamless for the customers. But having said that, we certainly are grateful for the additional allowance of vaccine to our state, and our local health departments will work with the pharmacies in their areas to make sure that we manually put together a process to coordinate that until we can get an automated system put in place. Okay, Taylor, did you have any more questions that were sent in ahead of time?
Yeah, we have several more. Matt Albertine with the Journal Star says, why is the retail pharmacy program leaving out any of the state's largest cities? I can't find any pharmacy in Lincoln or Grand Island participating, although it looks like there might be 1 or 2 small ones in Omaha. Is that on purpose or is it an oversight?
So Matt Oberding from the Lincoln Journal Star is saying, with regard to the federal pharmacy program, it appears that there's no pharmacies in Lincoln or Grand Island and only a couple in Omaha. Is that on purpose? And that gets back to the pharmacies that have signed up for that program. And again, we just don't have a lot of information coming from the federal government with regard to this. But my understanding is that there will be pharmacies there are pharmacies who have signed up here, for example, in Lincoln. Just maybe those locations have not been announced yet. So I would say stay tuned with regard to that. And again, we still have more work to do with regard to communication about those pharmacies and working with them to make sure that they're following the state guidelines and all that.
Don Walton asked, do you believe the Nebraska Republican Party should censure Ben Sass, as requested by some county parties, for his failure to support former President Trump in ongoing impeachment proceedings?
So Don Walton of the Lincoln Journal Star is asking if I believe that the State Central Committee of the Republican Party should censure Ben Sass with regard to his dealings with regard to the Trump administration and the impeachment and all that sort of thing. And I've commented on this before. Take a step back. Our State Central Committee meeting was supposed to be this Saturday. It has been postponed due to the weather that is coming in. So ultimately, this will be a decision by the State Central Committee. What I've encouraged is folks to reach out to Senator Sass directly or to his office and engage in a dialogue with regard to this. I've certainly heard a lot of people who are sharing with me their frustrations with regard to Senator Sass. Again, I encourage that dialogue.
Joe Dacre asked, what is the latest best estimate of the date when Metro Omaha and Lincoln teachers will receive coronavirus vaccinations?
Joe Dacko wants to know when, from the Omaha World Herald, wants to know if we have a date for when teachers in Omaha and Lincoln will be receiving vaccines. And we do not have a date. We've not published a date around that. Teachers are in Phase 1B. The entire state's in Phase 1B. All of our local health departments are in Phase 1B. However, we're starting with the folks who are most at risk, which is those folks who are 65 years or older. So we're going to be working on that population first to be able to make sure that we're getting to the people who are most likely to have a severe reaction, and then we'll be working through the other categories of that. The direction I've given to local health departments is focus 90% of your vaccines on the 65 years and older folks. You can have flexibility with 10% extra if you have other populations that you want to address that are within Phase 1B, that first tier of Phase 1B, but really focus on 65 years and older, because when you look at our mortality rate, for example, again, if you look at 65 years and older has a mortality rate that's nearly 10 times more than the next age bracket down of 45 to 64. So 45 to 64 has 56 deaths per 100,000. 65 and above has 509. So you can see it's a lot more. That's why we're focusing on 65-year-olds and above.
Joe also asked, will you be taking any steps to help Nebraska schools address the learning loss students have experienced because of the pandemic disruptions?
Joe is also asking if we're going to be taking steps with regard to helping schools make up for the learning loss that they've experienced during the pandemic. Obviously, there was a report in the World Herald that showed, really demonstrated the learning loss we've seen throughout the course of this pandemic, and we want that, that learning loss has to be made up. We want to help those kids get caught back up that need it, and so we're here to be able to help the schools be able to do that. We got a very good working relationship with the State Board of with the Department of Education and the State Board of Education with regard to, I'm sure they're working on plans to be able to address that, and we'll just continue to work with them.
We have a similar question from both Bailey at 1011 and Lee at WWT. Have we had any luck getting the 6,000 people who haven't gotten their second vaccines to come back and get them?
So both Bailey at, where's 1011 and Lee at WWT are asking, have we been able to make progress on the 6,000 people who have not come back for their second round of doses? So actually, I'm going to take this as an opportunity to encourage you, if you've got that first round vaccine, please come get the second round of vaccine when you are due. As Dr. Lasser showed, he held up his little card. You got a little piece of paper to tell you when to come back. So please schedule to come back and get that second dose. That will give you full immunity protection. So we really encourage people, come back and get that. That's how you're going to get the full immunity. And I don't have any numbers off the top of my head where we are with regard to the second dose. Dr. Antone, do you have anything off?
I thought I heard Angie say yesterday it's down to 4,300 now.
So Dr. Antone believes we've got that down to 4,300 now, but what we'll do is we'll follow up with both Bailey and Lee with regard to the specifics of that. But we are making progress in getting those folks in.
Bailey also asked, how will this one-stop portal impact Nebraskans? Can we give an example of how it's more efficient than the system that was in place before?
Sure. So Bailey is also asking, how does this one-stop portal help Nebraskans, and how is it more efficient than we were doing before? And Matt, I'm going to ask you to come up and talk a little bit about kind of how this all came about a little bit, and about how it's going to help people, be more efficient in setting up their businesses here in Nebraska.
Yeah, so before the portal, if you were going to start a business in Nebraska, you had to go on a search of different websites of different agencies in order to find all the filings. Tax IDs, license, inspections, checking with the fire marshal, checking with the Department of Labor. It was really on the user, the person trying to start a business, to go through all the different steps of trying to find all the paperwork. And at best, you got them all and you weren't sure. Or sometimes what would happen is a couple of the different filings would slip through the cracks. And that's pretty typical with a lot of governments of how they do this process. The one-stop portal takes a lot of the guesswork out of it. It's the one-stop shop. If you're going to start a business, let's say you're going to start selling steaks or other agricultural products, you could go to this site, put in a couple of drop-down boxes of what kind of business you're looking to get into, and it will show you all the different filings. It'll bring you links to all the filings so you have all the information you need in one spot, making it a lot easier for the user. Does that
I think that's good.
Okay.
We have a question from Patrick in Hughes, Nebraska. With the federal pharmacy program starting up at places like Walmart soon, does the state have any input on which towns and cities are serviced by the program?
So Patrick, I'm sorry, where's Patrick from?
Hughes, Nebraska.
News Channel Nebraska is asking, did the state have any input on where the pharmacy locations are? Walmart is getting ready to, again, I believe Walmart announced their locations that they've got it. So, for example, Walmart obviously is one of them. Do we have any input in that? And actually, we did not. So the pharmacy signed up for the program. The state did not have any input about which pharmacy signed up or where they were located.
And then our last submitted question I have so far is from Julie Anderson at the World Herald. Is Douglas County getting its proper share of vaccine? We're seeing numbers indicating that it's not.
Julie Anderson, of the Omaha World Herald, is saying, is Douglas County getting its proper number of vaccine? They're seeing numbers or not. And Douglas County is getting the vaccine that they were allocated as far as the overall state allocation. I've not heard anything different. And Dr. Antone, I know, had to step out because he had another call to jump on with federal authorities. But if you show us the numbers you're looking at, Julie, we can maybe help resolve the difference between what you're seeing and what we are delivering to Douglas County.
That's all I got.
All right, that's all the questions that were sent in. Paul?
Can you say, what exactly do you want to happen in this dialogue between the Republican Central Committee and Senator Sass?
So ultimately, as I mentioned, with regard to, I'm sure you're talking about the censure, Senator Sass that's been proposed, that the folks who are frustrated with Senator Sass, I encourage them to reach out directly and have that dialogue and talk to him. Ultimately, like I said, it'll be up to the State Central Committee to vote on censure. But if you're frustrated with Senator Sass, reach out to him in his office to talk about why are you unhappy.
What do you think that would accomplish? He's got a point of view, and obviously some people in the Republican Party have a different point of view.
Well, Paul, so Paul's saying there's just some reviews, what you're going to accomplish. Paul, I hope you don't mean to suggest that anytime we have a disagreement with people, we shouldn't talk to them. No, then we want to, when we have disagreements, we should talk to people and find out where they're coming from, and maybe we can find areas of common ground, or, you know, sometimes we have to agree to disagree, but that dialogue is important in sharing different people's perspectives.
I think you've already made clear you're not a fan of the impeachment, but should President Trump face some sort of penalty or retribution, you know, some kind of censor or something for what occurred?
So Paul's asking, should the president face some sort of censure for whatever occurred, for what occurred on January 6th? And again, I'm not a fan of the impeachment trials. I don't believe they're constitutional, and I believe they're divisive. I believe it's just continuing to create the division in our country that the Biden administration is trying to bring, when the Biden administration is trying to bring us together, and at a time we should be focusing on that transition to the new administration to make sure that runs smoothly. That's in the benefit of everybody here in this country. So I think it's a divisive process. And with regard to what President Trump deserves or doesn't deserve, I think the greater good of the country is about trying to move on and focus on that unity for our country. Andrew. So I don't believe that the administration, or I don't believe the impeachment hearing should go forward. I don't believe that that's in the best interest of the country. And again, ultimately, if you go back to January 6th, just like the protests and the riots that we had last summer, each of those individuals who participated in that was individually responsible for taking those steps to do that. Each of those individuals made the decision that they were going to perform those acts of violence in those situations.
I guess going back to Paul's question, do you personally believe that Senator Sass has overstepped the line in his criticism towards former President Trump?
So Andrew's asking, do I believe that Senator Sass has overstepped the line with regard to his criticism of President Trump? As we were talking about earlier, there's just times we're going to agree to disagree. I don't agree with the things that Senator Sass has done with regard to the administration. Ultimately, though, I think that this impeachment hearing is divisive for our country, and we need to move on and coming together in unity and working on this smooth transition for the Biden administration. Yes.
And can you kind of explain a little bit about the disparity in rankings,
So you're talking about the rankings of vaccinations? So Andrew's asking about why isn't there more consistency, or why is there a discrepancy in the vaccination rankings that are being put out there? And again, part of it is a data issue. So when we realized that the CDC was not reflecting the amount of vaccinations we'd administered, we reached out to them, found that they had a problem with regard to their process of reporting that. So we believe that that gap between what we're doing and what they're reporting is actually narrowing. So we're making progress there. The other thing too is just part of what are you measuring? So for example, I noticed one day last week when I looked at the New York Times website, Alaska was ranked number 3. They had administered 62% of all the vaccines they had been given. Nebraska had also had administered 62% of all the vaccines we've been given, yet we were ranked far down on the list. And that's just because Alaska had given a first dose out to 13% of their population, and we had given a first dose out to 7%. We aren't really placing a lot of emphasis on that first dose. We're looking more at the second dose because that's when you get full immunity. So it really depends, what are you measuring? What's important to you? The things the New York Times was ranking that by, at least in their initial thing, was not something that we were focused on as much as how many people were getting to that second dose. And if you reorder the table, then it changed the order of where Nebraska popped up. So it's two things. It's making sure the data is right, and it's also about what are you measuring.
I guess for the federal retail pharmacy vaccines, will people have to pay any money for those, or is there any safeguards that the pharmacy won't charge anyone?
So with regard to the federal retail pharmacy program, will people be charged for that? So the person directly should receive no charge for that vaccine. Now, they may ask for your insurance card, and they may charge a fee to your insurance company, but if you don't have that insurance card, you're still going to get the vaccine. You don't have to pay anything. So we encourage people, if a pharmacy is trying to charge you, if they're trying to get money out of pocket from you, please let us know, because they're not supposed to be doing that. Like I said, they may ask you for an insurance card. They may charge a fee to your insurance company, but if you have no insurance company, they're still supposed to give you the vaccine and not charge you anything. So again, don't pay any money to get the vaccine. That's not how it's supposed to work. Paul?
How much longer do you have to wear a mask according to the CDC?
So according to the DHM we published, I'll be wearing the mask through up until Saturday night.
So another additional week, is it?
Today's Wednesday, so 4 more days.
You comment about broadband. If you look at how much money the state's devoted through its universal service fund, it's about $400 million over the last decade. And there are a lot of complaints at these hearings, I'm sure you heard them too, that, boy, there's been a lot of money spent and not a lot of progress. And now you're saying, let's spend $40 million of state funds. Can you comment on that? Is that throwing good money after bad, you think? Do you have concerns about how much has been spent and how little's been done?
So the question was, Paul said over the last decade, we spent about $400 million and of state money.
Count federal.
State money, plus the additional federal money coming in. And yet we still have about 80,000 Nebraskans who are unserved, and 150,000 that are maybe underserved based upon trying to get to 100 by 100, 100 up, megabytes up and 100 megabytes down. So what does it mean to do additional money, the additional $20 million? And this is like rural telephone, rural electrification. This is basic infrastructure that we have to make sure that every Nebraskan has the opportunity to be able to grow a business in their small town or rural community. So this is basic infrastructure that we have to invest in to be able to accomplish that. And what I'm proposing, along with Chairman Friesen and Speaker Hilgers, is that we step up the pace of that investment with $20 million in each of the next 2 years. Now, is that going to finish the job? No, but it'll get us 30,000 of those 80,000 Nebraskans who are not even getting 25 3-speed right now. And so that will help us make progress. The state will need to continue to invest in the future to make sure that we cover the rest of those folks. So again, it is an issue for a lot of Nebraskans. We can't solve it all at once, But let's take some steps to start solving it for the folks we can solve it with.
What about, do you think, you're a process guy, you just had your process guy here. Do you think they've spent their money efficiently over the last decade to expand broadband? Has there been some missteps there? What do you think?
So the question was, do I think the money's been spent efficiently to expand broadband? And again, there's probably been projects that haven't gone as well, but broadly speaking, what we're addressing is the area where the companies find it uneconomic to finish, which is that last mile. And there's a lot of work on completing that last mile to all these Nebraska households. And that's what our program is really focusing on, is trying to get that last mile of infrastructure to the home so that they can access broadband anywhere in the state. So with regard to the previous program, there's a lot of ground to cover to be able to get that last mile. So money's been invested, but we need to be, our program is focusing on that last mile to make sure we're focusing on that piece that is the part that a lot of the companies don't find economic to do.
It's just expensive to get it done.
It is expensive to get it done. That's exactly right. One last question. Andrew.
What do you define as getting back to normal? And when will we be there? And when will you know that we're there?
So Andrew is asking, what do I define as being back to normal and when are we going to get there? So I think that there's going to be a new normal when we get through this pandemic. The pandemic has been going on for almost a year now in this country, and so it's going to change us. I expect that we will start seeing getting back to more normal the second half of the year, maybe late this summer. As we get people vaccinated, we're going to see our hospitalization rates drop, we're going to see our case counts drop, all that sort of thing. And that's when we'll be able to take the steps to be able to have people get back together again on a more normal basis, where you won't have to wear your mask when you go to the store. You won't have to be concerned about keeping that 6 feet of distance between you and other people so much. Now, do I think there's going to be changes? Do we think we're always going to be a little bit more conscious now about that? Yeah, we're probably going to be a little bit more conscious about that. You probably will see more mask wearing even after we leave the state of emergency here in the state, and it's not part of our directed health measures. But I think that what we'll probably be looking at is the second half of this year as we get people vaccinated, and this is why it's so important. I appreciate Dr. Lassiter being here. It's so important for everybody to get that vaccine so we can really work our way through this pandemic, create that immunity so that the virus cannot spread. All right, folks, again, thank you very much. Appreciate it. Please continue, though. We're not through the pandemic yet. Avoid the 3 C's, that close contact, crowded spaces, confined places. Make sure you're washing your hands often, keeping that 6 foot of distance, wearing your mask. And again, if you have those symptoms like a fever, cough, lost your sense of taste and smell, please stay home. Remember to ask your doctor about the monoclonal antibody treatments. Doctors, remember to get educated on that. It's an important treatment to be able to make sure you minimize the severity of the symptoms for folks, especially folks who are older. Please use all that. We'll be back here 10 a.m. on Friday. Thank you all very much. Have a good one. Thank you, Francis.